Hey everybody. How are you? How are you? Today we're going to be talking um, about what postpartum really does to your hormones. And by the way, no one recovers in 6 weeks, okay? No one. So you just had a baby. 6 weeks later, your OB clears you and says, okay, you're good to go. Okay. But you don't feel good to go, right? You feel anxious, exhausted, disconnected, like you've lost yourself somewhere in the process. Here's what's actually happening in your body and why 6 weeks is not enough. All right. During pregnancy, your estrogen and progesterone are at some of the highest levels that they'll ever be in your entire life. The moment you deliver that placenta, those levels crash dramatically and rapidly. We're talking about one of the most significant hormonal shifts a human body can experience ever. Okay? This crash is your physiological trigger for the baby blues, right? That weepiness, the overwhelm, the emotional fragility in that first week or two. That part is normal. Okay. What's not normal, but extremely common, is when that instability persists, when the anxiety doesn't lift, when the brain fog won't clear, when you can't sleep even when the baby sleeps, when you feel like a stranger in your own body months later. Okay. What's really going on in 6 weeks? At your 6 week postpartum visit, most movies are checking your uterus and your incision if you had a C-section, right? Nobody's checking your thyroid, but postpartum thyroiditis affects 10% of women and is wildly undiagnosed. Nobody's checking your cortisol, but the sleep disruption and physical demands of early motherhood create a chronic stress state that can dysregulate your entire hormonal axis. Nobody's talking about testosterone, which is often depleted postpartum and during breastfeeding, contributing to low libido and low motivation. That's often mistaken for depression. What about iron? What about ferritin? What about your estrogen? Right? These are often very critically low after delivering and breastfeeding. Low ferritin alone can cause prolonged fatigue, hair loss, brain fog, and anxiety. Okay. So, real postpartum recovery takes 6 months to a year, sometimes longer. And it requires active support, not just time. So at 6 weeks, what we should be doing? We should be getting a comprehensive lab panel, right? Ask for a ferritin, ask for inflammatory markers, ask for a full thyroid panel with TPO antibodies and a full sex hormone panel and cortisol and vitamin D. Nutrition matters enormously right now. Protein at every meal, healthy fats, iron rich foods, and adequate calories if you're breastfeeding. Your body is doing an enormous amount of work. And sleep protection is non negotiable. I know you have a newborn. Listen, I'm a mom to 3 kids, okay? But you can do one longer sleep stretch per night with a partner or support person covering. That single block of deep sleep changes everything metabolomically. And it's so important. And if your symptoms are significant, anxiety, intrusive thoughts, rage, deep disconnection, please reach out both to your physician and a mental health provider. Postpartum mood disorders are medical conditions, not personality flaws. You hear me, ladies? Listen, please share this with every single new mom you know. We have got to be talking about this, okay? And if you're in this season yourself, you're not alone, you're not weak, and you don't have to push through this, okay? If you feel like something is off, it is. Okay? If you feel like something is off, it is. You're not crazy. And if you go to your OB or you go to a provider and they're not listening to you and they're telling you this is normal and you know it's not, please seek a provider who knows that it isn't and is willing to help because we're out here. We're out here. Okay? You're not alone in this. And it's not normal and it's not something you just have to deal with. Okay? It deserves a wider picture than just looking. Your 6 week checkup deserves a wider picture and thought process than just making sure your uterus is okay. Okay? Because I don't know about you or if you knew this, but we're more than just our uteruses. Okay? Share this with a friend. If you need help, reach out. We are here. Okay? Until next time, stay well.